Hi, it's Ashley with Complete Health Benefit Solutions, and this video is going to talk about the UPREHS plan once you start Medicare. So it becomes the UPREHS Secondary Plan that pays secondary to Medicare. So we're going to get into really what that means for you, how those benefits work, the cost, and then really how it compares to original Medicare and a Medicare supplement plan, which also pays secondary to Medicare. So as I said, we're going to do a general overview. Please note that this is not to be confused with those of you who have your benefits through the GA 23111 plan, the Plan F. This is not applicable to people who have that plan. This is also not going to be applicable to non-agreement individuals who don't have an actual railroad plan once they start Medicare. Those individuals, for the most part, will purchase their own Medicare supplement plan and have a health reimbursement account instead. If you are already on Medicare and you're not sure what you have, look at your card on the top right side. So it's not quite in the top right corner, but near that. If it says Plan F or the GA 23111, again, this is not going to be applicable. This is specific to the UPREHS benefits. So I don't want to get that confused. We will also talk about how those benefits work under and over age 65 when you're on Medicare. We will touch real quickly on spousal coverage because you need to understand how that changes. If you went on Medicare before age 65 because you were deemed disabled, once you turn 65, that's going to have a huge impact on your spouse's coverage. Also, real quick, we're going to touch on the options for your spouse for Medicare supplement plans. And then, like I said, how the UPREHS benefits compare to Medicare Supplement Plan G. And then lastly, what you should be considering. Everybody is going to have different factors to consider, such as your health situations, age, location, finances, and then comfort level. There's a lot to be said for, what just makes you comfortable. We're going to take a look at what the numbers look like, and finally some examples from analyses that I have done for other UP retirees. And lastly, it is your retirement, it is your money. My purpose is purely educational. A lot of people have asked how exactly this plan works, especially compared to the type of Medicare plans that their friends and family members who are not railroad have. So that's what we're going to take a look at. So UPREHS and Medicare. Once you start Medicare, how does your UPREHS plan work? So you're eligible for the Medicare Secondary Plan when you start Medicare, which could be before age 65 if you are disabled, or at age 65, but you also have to be no longer actively working. Not all UP retirees are offered the UPREHS benefits. So like I said, that's usually going to be non-agreement retirees. And whether or not you're offered the UPREHS plan is going to depend on your union and location. So it's important to understand that once you start Medicare, you don't have a choice on what railroad benefits you still have available to you. You also cannot keep your benefits as they are today before you start Medicare. You do have to take Medicare Part A and B and you do have to take the UPREHS Secondary Plan if that's the plan you're being offered and you want to keep railroad benefits. They will work differently than the benefits that you had before, so it's important to understand, and that's what we're going to walk through. Many people are not aware that you do have to enroll in Medicare Parts A and B. If you're no longer actively working, the railroad does a very good job of automatically enrolling you in Medicare Parts A and B. But the piece that a lot of people don't know is that you have to pay for Part B. So for Part A, most people don't pay for as long as you worked 40 quarters in your life. Medicare Part A has already been paid for. Part B, if you're enrolling in 2019, is going to have a monthly premium of $135.50. The railroad will automatically withhold that from your monthly annuity check, so you don't have to worry about paying that. But that's a significant dollar amount if you are budgeting and only looking at the $255 that you pay for the UPREHS plan. So make sure you're factoring in that $135.50 as well. You do not, though, have to pay for Part D, which is a prescription drug plan. If you have the UPREHS secondary plan, you're also going to have the OptumRx, I believe that it is, prescription benefits. So it is a Part D drug plan, but it requires that you use Drug Depot for mail order, a lot like the benefits that you're used to. But in order to have the secondary plan, you will pay a $255 per month premium, and I believe that is not too far off from what you pay if you are retired early, although I could be off on that. Once you start Medicare, though, you will pay Part B in the $255 per month per individual for the UPREHS Medicare Secondary Plan. It is very, very important to know that, if you are an early retiree, disabled or not, and you kept your UP coverage, that coverage is not going to stay the same for your spouse when you turn 65 and they are not yet eligible for Medicare. So in order for your spouse to keep coverage, they are going to, in most situations, have to elect COBRA in order to keep benefits from the railroad. COBRA, I believe in June, went up to almost $1,300 a month. I just want to make the point that that is extremely, extremely high, especially if your spouse is healthy. That is a lot of money to pay to keep those benefits, especially when you have a deductible and an out-of-pocket to reach. So like I say here, except for in rare circumstances, you're likely going to have other coverage options that could be anywhere from 70 to 50% less than the $1,200, or I think it recently changed to almost $1,300 in COBRA cost. That is a completely separate video. I did a whole video talking about different coverage options and comparing those options to the COBRA plan. So please, if you need that, ask for it or feel free to give me a call. I have saved retirees a lot of money. I'm talking $400, $500, $800 a month for their spouse's coverage, not paying for the COBRA premiums. So if you're in that situation, let's talk about it, see what other options are available in your area. So it's also important to understand the difference between the UPREHS benefits and what's available on the market. You really want to look at two things: cost. So when is the UPREHS benefit right for you and when it might not be. And then the details within the benefits. Everyone entering Medicare is faced with decisions that can impact their healthcare access and their finances for the rest of their life. It's important to be informed and continue to inform yourself. So if you're having a little bit of anxiety about this transition, don't worry. Everybody faces tough Medicare decisions, but informing yourself like you're doing right now is about the best thing that you can do. So I want to start with doing kind of a side-by-side comparison of the UPREHS Secondary Plan and a Medicare Supplement Plan G, because they're about, Plan G is probably the closest to the UPREHS plan that is available on the market. So we're going to kind of look at that and see how they're similar and how they might be different. So I'm going to have them side by side here. Both plans require that you have original Medicare, so that's Medicare Parts A and B. Both plans, for the most part, are going to cover 100% of all Medicare covered services. So that is kind of an important distinction to make, that throughout the rest of this, when talking about benefits, when I say covers everything after Medicare pays, or 100% after Medicare pays, or what Medicare doesn't, then please understand that that means or is assuming a covered service. So for most part, the general rule of thumb is that anything secondary to Medicare is going to cover the benefits if Medicare covered it. So on Medicare.gov, there's also an app that you can put on your phone. They have a page where you can type in a service or the name of a procedure or a piece of durable medical equipment that you can check and see if Medicare covers it. It's a really good resource. Reach out to me if you have trouble finding it. But again, this is assuming that the service is covered by Medicare. So with Plan G, the only expenses that you can expect to pay in a calendar year is the Part B deductible, which is only $185. Besides that, Plan G is always going to cover 100% of everything after Medicare pays. Also staying on the Plan G side, prescription drug coverage is not included like it is on the UPREHS plan, so you do have to purchase that separately. So that is an extra premium to be aware of. But drug plan premiums for the most part are very low, $15 to $25 in most cases. The premiums start going up. I don't think I've ever seen one over $90 if you're on some very expensive classes of drugs, but for the most part, $20, give or take. I would not look at it as a disadvantage that you purchase your drug plan separately. That is actually something that I really like about Medicare supplement plans, and that is because you don't have to kind of weigh and pick what falls in the middle or sacrifice medical benefits to get the right drug plan. You also don't have to sacrifice drug benefits to get the right medical plan. So you get to pick them separately. Plus, if you're on a regular Part D plan, you should be shopping that plan every single year. So how the drug companies cover different drugs changes on a yearly basis. It could come on and off the formulary. It could change tiers in the formulary, or that insurance companies' cost of that specific drug, their deal with the manufacturer can change year to year. all of those impact what you pay out of pocket. So I encourage the people that I work with to shop that plan every year. Point being, just don't look at that as a disadvantage. It's actually a very strong plus. Going over to the UPREHS side, so just like a supplement plan G, it pays secondary to Medicare. So in both situations, you have original Medicare Part A and B as your primary insurance. The UPREHS plan covers all of the Medicare deductibles and co-insurances. A lot of people, including Medicare, refer to the co-insurances as copays, even though it's almost always a percentage. Sorry, I skipped ahead on us. And then, like I mentioned before, the drug plan with the UPREHS plan is included in your coverage and your premium. So you do not have to pay an extra premium for your drug plan. Moving on, with Supplement Plan G, there is no physician or facility network. So you have the freedom to access care from doctors who do or don't accept Medicare. Medicare in itself does not have a network. You very simply have doctors who accept Medicare and doctors who don't. If you want to see a doctor who does not accept Medicare, that's fine. Medicare is going to pay the same benefit amount. It's just the doctor can charge you up to 15% above what Medicare is going to pay or consider for your benefits. That's called excess charges. Plan G covers that. So essentially with original Medicare and a Plan G, you can go to any doctor or facility in the country, whether or not they accept Medicare, and you should not take on any additional cost for that. With the UPREHS Secondary Plan, there actually is a network. So in the benefit guide, which I have read front to back, I include the website that you can find it in if you have not read it later in our presentation here, or reach out to me. I'm happy to email you the link, but it references over and over and over participating providers, and how if you do not go to a participating provider, aka out of network, that the secondary plan may not pay anything after original Medicare pays. Now, at the same time, I have never talked to anybody who has experienced the plan not paying or a doctor being out of the network, but for as many times as it is referenced in that benefit guide, which is the plan document. So, if there is a dispute, that is absolutely what's going to hold up. I absolutely encourage that you're checking your doctors and facilities and understand what's going to be in network and what's not, since they make it very clear in there that they don't have to pay when you access care from non-participating providers. So that's on pages 11, 13, and 16 of that benefit guide. Now, here's where we get into kind of the nitty-gritty of the actual benefits and the differences. So what you're going to see in red is basically a benefit that is less than the other plan. Or if you see it in green, it's a benefit that is better than the other plan that it is being compared to. So you can get some insight. Now I'll tell you, the UPREHS Secondary Plan is a very strong plan. There were just some key benefits that really jumped out to me as what I knew was not as rich as a Medicare supplement plan that I just wanted to educate you on. So this came from having several retirees that I was working with asking specific questions and reading through the benefit guide to research that, and stuff jumping out at me and being like, hey, I wonder if people are aware of this. So again, this is just to make sure that you are informed of how your benefits are going to work. So with the supplement Plan G, blood transfusions, which again is not very common. Most of these differences that you're going to see here are not common everyday things, but when they do come up, they can be pretty significant. So a Plan G is going to cover the first 3 pints of blood that Medicare does not cover, whereas on the UPREHS plan, if the provider has to buy blood for you, you must either pay the provider for the cost of the first 3 pints, or it has to be donated by you or somebody else. Not a huge one, but still an expense where if it came up, you would be responsible for that cost. Medicare doesn't pay anything for the cost of the first 3 pints of blood. Inpatient hospital is the next one, and this is very possibly the most significant benefit on here that I really wanted to call out and make sure that people understand how this benefit works. So on original Medicare, which remember that's your primary insurance, Part A is going to pay 100% of your inpatient hospital costs after you've met the Part A deductible, so that's $1,340 for the benefit period. That can happen multiple times in a year. As long as you've gone 60 days without being in the hospital, you're in a new benefit period. So you can see how that can happen 4 or 5 times in 1 year if you're in and out of the hospital. So you can meet that over $1,300 deductible multiple times. And that's all of your responsibility if you're released from the hospital within 60 days. If you are in the hospital between 61 and 90 days, you have a very significant daily coinsurance or copay. Both the Plan G and the UPREHS plan is going to pick up all of that, okay? If you are in the hospital beyond 90 days, there's an even higher coinsurance or copay. Plan G is going to pick that up, so is the UPREHS plan. But if you're in the hospital beyond 150 days, Medicare is not going to pay anything else. Plan G is going to pay up to 365 days beyond your 60 lifetime reserve days. So again, Plan G is going to pick up an additional 365 days after your 60 lifetime reserve days that you start counting up after you have had 90 days in one benefit period that you have been in the hospital continuously. Everything within that, so your 90 days, the 60 reserve days, the 365 days, with a Plan G, you're paying nothing. Now, with the UPREHS Secondary Plan, you're also going to pay nothing if you are within a benefit period in the hospital less than 150 days. You're not paying anything. But where the UPREHS plan differs from a Plan G and is a little bit concerning is they don't offer any additional coverage beyond that. So when Medicare stops paying because you've been in the hospital too long, the UPREHS plan is not going to pay anything for you either. You'll have your 60 lifetime reserve days, but nothing beyond that. There are absolutely situations that you can end up in the hospital for an extended amount of time. So although not common, If it does happen, this could leave you exposed to some pretty significant costs. Also notice there in the red is that it does not cover any inpatient substance abuse services under the UPREHS plan. You'll see here in a second how the UPREHS plan treats pretty much all mental health services. Chiropractic care, now this benefit is interesting, and I haven't mentioned this yet, so I will. All of the language here is copied and pasted directly out of that benefit guide. So none of this is my own language. The Plan G language is copied and pasted from a Plan G outline of coverage. So none of this is of my own invention or creativity. This is plan language. So for chiropractic care, the UPREHS plan is going to pay 80% of the remaining amount after Medicare pays. So all outpatient services with Medicare, it's Part B, you have the yearly $185 deductible, and then after that Medicare pays 80%, you only pay 20%. Of that 20% that you have to pay, the UPREHS plan is going to pay 80% of that, and you're left with 20% of 20% of the original bill. They're also going to limit that annually to $600 after Medicare. Diabetic supplies, again, the difference here is that the plan does not cover the Medicare deductible or coinsurance for diabetic shoes. So whereas a Plan G would cover, is always going to cover the amount that is your responsibility after Medicare pays, the UPREHS plan just for diabetic shoes is not going to cover your responsibility after Medicare pays. So Medicare is going to cover it and pay it. The UPREHS plan is then not going to pick up your responsibility, but just for diabetic shoes. Probably the second most important benefit category that was of concern to me is durable medical equipment. So often referred to as DME. UPREHS has a very short list here of the DME that it is going to cover after Medicare pays. So you can see CPAP, units and supplies, oxygen, walkers, crutches, wheelchair benefits, although those wheelchair benefits are limited to $400 per year, braces, canes, nebulizers, and TENS units. There are so many more pieces of durable medical equipment, some that can be very, very high cost that the UPREHS plan is not going to cover. Again, not something that is going to impact most people on a day-to-day basis, or probably really even regularly. But key things that I see that are left out of this that are covered under durable medical equipment are things like hospital beds, when you need to have a hospital bed in the home. If you need a motorized wheelchair, a $400 annual limit is not going to get you very far. There are wound backs that sometimes you have to rent to be able to use in the home, or for a home healthcare professional to use at the home. There are really just a lot of things that fall underneath this benefit that appears to be limited or not covered by the UPREHS plan, where it would be covered fully for you under or with a Plan G. Eyeglasses for after you have cataract surgery. So Medicare is going to cover a full pair of glasses after you have cataract surgery. For some reason, the UPREHS plan is only going to pick up your cost for the lenses. You have to pay the cost that is left over after Medicare pays for the frames. Probably shouldn't be too significant, but nonetheless, still there. Mental health services. This is probably my number 3 out of this pretty short list. So the UPREHS plan essentially does not pay for any mental health services, inpatient or outpatient, which, I don't know. Even for people who have not needed to utilize mental health services, so that's counseling, seeing a psychologist, group therapy sessions, even for people who have never had to utilize that, there are a lot of changes that happen later in life. If people lose adult children, they lose spouses they've been married to for 40 or 50 or more years, where mental health services can become very important. Medicare is still going to cover those services, primary, but the UPREHS plan is not going to pay secondary, whereas a supplement plan would. So that is both inpatient, outpatient, and partial hospitalizations, unless the diagnosis is Alzheimer's or dementia. Now, as far as I'm aware, Alzheimer's and dementia are not even mental health services, mental health care categorized services. So those are medical conditions, not mental health conditions. So normally those wouldn't fall under these categories anyways. The UPREHS plan, again, is not going to cover therapeutic shoes, although Medicare will. So just like the diabetic shoes, they're not going to cover any Medicare covered therapeutic shoes. Vision care, so where the UPREHS plan is actually stronger than a Medicare Supplement Plan G, is in the fact that it will pay up to $760 per eye once in your lifetime for a refractive surgery. So that's basically going to be surgery that is to correct your vision. So think LASIK. That is not going to be covered under your original Medicare plan, or with a Medicare secondary plan like Plan G. So I would be more than happy to give you the outline of coverage for Medicare Supplement Plan G from your state. Just shoot me an email, give me a call, ask for it. Also here, I included the link so you can jot that down or give me a call. Like I said, I'm happy to send it to you for the UPREHS evidence of coverage for the Medicare secondary plan. I always want to be 110% transparent. I want you to see the information for yourself and not just take my word for it. So although I did copy and paste this language directly, I also want to make it available directly to you to review yourself. So a couple of just important considerations, I think, are 2 things. Your medication costs, if you were to be considering, maybe not taking the UPREHS plan and going with a Medicare supplement plan, the one place where you could be actually making a sacrifice is the cost of medications. I've analyzed this for many retirees, and there's only been one instance where the OptumRx plan had better coverage for the retirees' drugs than the best option that I found for them on a regular Part D drug plan. So that's something important to consider, but all of the other retirees, their drugs were actually cheaper with a different Part D plan, but that's going to be different for everybody. So it's important to specifically understand how your drug costs might change. Also, For people who are on Medicare under age 65, in most states, Medicare supplement plans for individuals on Medicare due to disability is significantly more expensive than the cost of supplement plans once you turn 65. And in that case, the UPREHS premium might just be a better bet for you. Once you turn 65, unless you're in a handful of states, New York, Washington, Connecticut, where supplement plans are much more expensive because the states it's a long story. I won't get into that. That's in another video. But unless you're in a state where Medicare supplement plans are exceptionally higher priced, then a lot of times a Plan G is going to cost you less than half of what the UPREHS plan costs. So where the UPREHS plan costs around $255, and that's per individual. So if you're a couple, you're going to be paying $510 a month for that coverage, whereas a Plan G in most states, for women age 65 can be under $100, and a Plan G for a male at 65 runs anywhere between $100 and $120. There's also Plan N that is even significantly cheaper and only slightly different than Plan G, which is going to be under $90 for both men and women. So there can be a pretty significant premium difference. Again, important to understand how your drug costs might change. And these examples that I'm going to show may not be may not be the case for people who are under age 65. I always tell people, I don't know your finances, I don't know your health history or your family's health history. And those are kind of two of the things that you really need to factor in with this information. So if your family has a history of needing mental health care and you know that this plan is not going to cover mental health care, that might lean you to more strongly consider a supplement plan. If you know that you already have an expensive piece of durable medical equipment that you're going to continue to need over time and may need more in the future, you may want to consider, especially if it's something that's rented and has a monthly cost, and you're going to get stuck with that 20% because the UPREHS plan isn't going to pay it. Again, something that may make you kind of more strongly consider a supplement plan. Also, for some people, that $1,300 a year in premium savings can be significant, especially when we're talking about a couple situation, two spouses on Medicare, almost $3,000 or even over $3,000 a year. Some people need that money. Sorry about that. Some people just don't want to spend more on premiums than they have to. Just know that, if you need to or want to save that money in premiums, the railroad option is not your only option. There is very, very good coverage available on the market, and Plan G is a good example of that. So let's look at one more. So this was a couple. So all of these numbers are combined for a husband and wife, both already age 65. So Medicare premium, they're going to be paying $260 a month. For the UPREHS premium, you're looking at $510. I was able to factor in the cost of their drugs. Not a big difference here. They were going to pay about $27 a month on average for their drugs with the UPREHS plan. Only $7 a month less with a Part D plan. But as you can see with a couple, for two Plan Gs, they're only going to pay about $225 a month. Now that is where this cost difference gets much more significant. So you're looking at $800 a month in total premiums compared to $526 a month in total premiums. In a year, that's over $9,500 compared to $6,300. That less the $185 Part B deductible for both of them gives them a total net savings of almost $2,900. Their straight premium savings was $3,245. But we'll take out that Part B deductible. We know they're both going to have to pay, but still leaving them with almost $2,900 in premium savings. So again, that is something that I just wanted to kind of walk through and show people. Again, the things that you need to factor in is your finances. I don't know if you need or if you want to just save that money. If that money gives you an extra golf trip or fishing trip, or maybe an extra trip to go see the grandkids or take the grandkids somewhere, that you wouldn't have that money otherwise, you would not be sacrificing good coverage to save that money on premiums. Also factor in your health history, your current health conditions, or your family's health history. If you know you have a really high probability of something down the road, that's where it's really important for you to understand the difference in the benefits. But I hope that was helpful. If you would like me to kind of work up that analysis for you, it will be different based on age, gender, and zip code. Those are the three things that supplement plans are priced on. I would be more than happy to do that for you. So just shoot me an email or give me a call and we can absolutely talk about it. Thank you for watching. Thank you for listening. And again, always here to help.